Welcome to Health Bulletin. Today, we're covering concerning health development from Queensland, Australia, which is currently grappling with an alarming situation. An 80% increase in Q fever cases in 2023. Wildlife rehabilitators in Australia are true heroes on the front line. They work day in and day out to save and care for our unique wildlife. But did you know that they face a hidden risk? These dedicated individuals are at risk of contracting Q fever, a serious zoonotic disease caused by Coxiella burnetii. Despite Australian government recommendations for AWR to receive Q fever vaccination, and the availability of a safe and effective vaccine in Australia, shortfalls in vaccine uptake have been observed in AWR. Health authorities are issuing a crucial reminder about the potential risks outbreak associated with Q fever. It's a bacterial infection that can be carried by both domestic and wild animals. Q fever is causing bacteria, commonly found in animals such as cattle, sheep, goats, and kangaroos. The bacterium can also be present in the environment, carried through dust and soil. The infection is typically transmitted by inhaling droplets or dust contaminated with birth fluids, feces, manure, or urine from infected animals. The organisms can be resistant to heat, drying, and many common disinfectants. These features enable the bacteria to survive for long periods in the environment. Public health physician at Darling Downs Health highlighted the diverse nature of Q fever symptoms, ranging from no symptoms to fever, headache, weight loss, nausea, cough, chills, fatigue, and the potential development of chronic fatigue. A small proportion, 1%, of acute cases, and up to 38% of chronic cases can be fatal, and with up to 5% requiring hospitalizations or developing endocarditis. Q fever symptoms typically manifest 2-3 weeks after exposure, but this period can vary from 4 days to 6 weeks. People exposed to animals, animal products, and animal waste are at higher risk of contracting Q fever. Health authorities strongly recommend vaccination, especially for those in high-risk industries such as abattoir and meat workers, farmers, veterinarians, animal hunters, wildlife workers, and dog and cat breeders. Pregnant women, in particular, face significant risks, including low birth weight, stillbirth, and miscarriage. To minimize the risk of Q fever infection during pregnancy, health authorities provide the following recommendations. Avoid assisting ewes, cows, or nanny goats during the birthing process. Steer clear of contact with newborn animals, afterbirth, birthing fluids, or materials contaminated by such birth products. Refrain from handling materials that may have come into contact with animals, their young, or afterbirths. Avoid handling fresh or aged feces or manure that may create dust or particles. Ensure partners or contacts who have attended birthing animals take appropriate health and hygiene precautions. Pregnant women experiencing fever or flu-like symptoms, or those concerned about potential infection from a farm environment, should seek medical advice promptly. In 2023, the region reported 86 reported cases of Q fever, indicating an alarming 80% increase compared to the previous year. Q fever is highly contagious and can spread to the general population. It's a concern for everyone. That's why it's important to raise awareness about Q fever and the risks faced by wildlife rehabilitators. By understanding the importance of vaccination and practicing good hygiene, we can all play a part in protecting these wildlife heroes. Thanks for watching, and if you enjoyed this video, make sure to subscribe to our channel. For more valuable content, stay healthy, and see you next time.